Good, happy Thursday morning, December 3rd, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Thursday morning, so let's begin. But first, we're going to begin with our COVID-19 updates. There are 566 new COVID-19 cases reported in New Hampshire, 9 additional deaths. There have been 22,332 known coronavirus cases since the beginning of the pandemic in New Hampshire. Let's take a listen to this video from WR News 9.
The state announced 566 new COVID-19 cases, the second highest single-day total so far. The daily positivity rate was over 6% for the second day in a row. Active cases fell for the second day in a row to just under 4,700. The state reported 9 deaths today. That is the most in a single day since June. 7 of those are connected to long-term care facilities, which continue to see COVID-19 outbreak.
Okay, and there you go on that video and that report. New Hampshire COVID updates, new information and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 22,332 number of people in New Hampshire have tested positive for COVID-19. 13,903,050 number of people in the United States have tested positive. 537 number of deaths from COVID-19 in New Hampshire. 842 number of people have been hospitalized with COVID-19 in New Hampshire. And 170 number of deaths from COVID-19 in the United States. And now let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Manchester, 769. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 4074. Now let's take a look at these 3 charts here. Let's start with the first chart here. New cases each day in New Hampshire. The purple, daily new positive COVID-19 cases. Orange, new hospitalization. And red, deaths. Let's take a look at this chart here. Current cases in the purple, total current COVID-19 cases. And orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases. Orange, total hospitalization. Red, deaths. And blue, recovered. Let's take a look at this chart here. Positive PCR test rate and daily PCR test. Let's take a look at this chart here. Age group of cases, female and male cases, and risk information. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder of your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. COVID-19 vaccine could be weeks away for long-term care facilities, New Hampshire health officials say. Faculty staff say they are ready to receive vaccine doses. Let's take a listen to that video from WR News 9, Andy Hirschberger.
I was referred to Bellwether Community Credit Union as I was having major issues with another institution. I applied online, and within 30
vaccine is on its way, and people who live and work in long-term care facilities will be first in line when it gets here. That was the focus of a call today between HHS officials and long-term care providers.
There are 3 leading candidates that require 2 doses of vaccine spaced by at least 3 weeks, and this is requiring an unprecedented infrastructure to ensure follow-up dosing with the same vaccine.
Dr. Elizabeth Talbot says some of the best news about these vaccines is that they appear to be equally effective in older people and younger people. She also said most of the trials showed virtually no side effects in any age group. But the vaccine won't help those who are already sick with COVID-19, and it won't stop the pandemic in its tracks.
As this is a new vaccine technology and people are appropriately asking questions about safety, there is no indication of any serious safety signal. So the numbers that have been released to us are very reassuring.
The New Hampshire Veterans Home in Tilton has been dealing with a coronavirus outbreak since November 10th. They've been in lockdown for almost a month, and 15 residents have died. The director there says that they've been preparing for a vaccine for a long time.
I think that we're ready. I just hope and pray that our veterans who still have choice say that they'll take that vaccine, and my staff as well, that they would all take that vaccine to protect themselves and their loved ones.
Must still be observed as the vaccine is rolled out in 4 phases. Reporting live, I'm Andy Hirschberger, WMUR News 9.
Okay, and there you go on that video and that report. State health officials discuss new CDC guidance on quarantine access to testing for schools. State guidance on quarantine remains unchanged. Let's take a listen to that video from WMUR News 9, Siobhan Lopez.
Snow piles up quickly. Remove it just as quickly with Kubota subcompact and compact tractors. Our #1.
State's top doctor talked about that new information released today by the CDC and also took questions from school districts. There were several concerns raised about access to testing for students and staff. Several asked about the BinaxNOW rapid tests, saying schools need that kind of access to fast results to be able to keep kids in school and not send them home and have them wait for a test. State epidemiologist Dr. Benjamin Chan says he has made similar arguments about getting these kinds of tests into schools, but right now it does not appear that there is any plan to do so. As far as the CDC's new guidance on the length of quarantine, Dr. Chan says no decisions have been made locally.
We literally have just read this guidance ourselves, and so we will be meeting further and discussing this and trying to figure out how best to adopt the information that the CDC has put out and how best to apply it to New Hampshire's situation.
Dr. Chan says as of right now, the guidance for quarantine in New Hampshire remains at 14 days. Reporting live, Siobhan Lopez, WMUR News 9.
Okay, and there you go on that video and that report. Portsmouth Rotary supporting restaurants with proceeds from Galley's ornament sale. Ornaments are $20 each. Let's take a listen to that video from WMUR News 9.
In the spirit of giving, the Portsmouth Rotary is using an annual holiday ornament tradition to help restaurants and waitstaff struggling during the pandemic. And this year, the Rotary is selling an ornament with the image of Gilly's Trolley Restaurant and will use the proceeds to buy restaurant gift certificates. Those certificates will be handed out to the restaurant workers.
To show appreciation to those people that have been literally on the front lines and been put out of work. That's the objective. It's twofold. Number one, buy something from the restaurants. Number two, help the staff.
These ornaments are available now in some stores and online. They sell for $20 each, and we can tell you they are very popular. Hundreds have already been purchased.
Okay, and there you go on that video and that report. New Hampshire long-term care facilities fighting COVID-19 outbreaks. Death toll rising. Currently 3 active nursing home outbreaks. Let's take a listen to that video from WMUR News 9, Jessica Moran.
Compact tractors.
Our job is to care for our veterans until their very last day. And this is not the way we want our residents to pass away.
The New Hampshire Veterans Home in Tilton says 15 residents have died since their COVID-19 outbreak started November 10th, and 46 residents and 40 staff members currently have the virus. The Veterans Home says they're getting help from FEMA.
We have 5 staff members that showed up on the 21st, and then 5 more on the 28th. They are on what they call 14 days tour duties or deployments.
In Hampton, Oceanside Center says 9 residents have died and 43 residents and 27 staff members have tested positive for COVID-19. In a statement to News 9, the chief medical officer expressed sympathy for the families and said in part, the center is currently performing whole house testing 3 to 4 times a week. During this pandemic, we have been stringent with restrictions and a whole host of other precautions. Further north, Coos County Nursing Hospital in West Stewartstown says 11 residents have died within the last month due to COVID-19. Also, an additional 5 residents died that they cannot directly attribute to the virus.
I guess what I didn't expect was just how it hit at once and has gone so fast through the whole building.
The administrator says staffing was an issue, but now quarantined employees are starting to return.
I know my staff is really, when the dust kind of settles, they're really going to grieve for the people we've lost.
And Coos County Nursing Hospital's administrator said what will help now is more money to hire more staff at better pay. She says sometimes people can make more selling cups of coffee than they can working inside the nursing homes. In studio, Jessica Moran, WMUR News 9.
Okay, and there you go on that video and that report. Police departments report staffing shortage, less police officer applicants, multiple departments with vacancies. Let's take a listen to that video from WMUR News 9, Charisse LeClaire.
Fall home improvement season is taking off at Beltate's Building Supply. From building materials to tools, paints, and everything else you need, we'll make fall home improvements a breeze. Shop online at beltates.com. Visit one of our 9 locations or place your order via phone or email.
We're constantly trying to bring more people in. So our hiring process is continuous now.
Manchester Police Chief Alan Aldenberg says departments like his are having to become more creative in hiring, turning to social media for recruitment, outreach through veteran organizations, and more.
We would give tests where we'd have a good showing of 250, 300 people. Now I'm down to 50 that are showing up. And out of that 50, let's be honest, I'll probably have 10 to 15 viable candidates.
There are 14 vacancies right now in the Manchester department.
If I got a dozen applicants, that's a lot now.
For Franklin Police Chief David Goldstein, that dozen quickly gets whittled down to 1 or 2 applicants who are truly qualified. In Nashua, recently, they were down about 15 officers.
Which is significant for an agency at only at 100, and we're authorized for 180. Actually, we're authorized for 176 from the chief down, roughly. So 13, 14, 15 vacancies is significant for us.
They've been able to make progress by adding a second recruitment officer and proactively seeking out recruits. Now they're only down about 3 officers. Chiefs say there are multiple reasons behind the decline.
Certainly part of that has to do with some of what's going on socially. Secondly, when some people come to find out that Oh, you mean I have to work midnights for the next 30 years or something? Yeah. That's right. Or I may not have weekends. No.
Manchester police say they're holding another test in the spring where they hope to see more applicants. In Manchester, I'm Charisse LeClaire, WMUR News.
Okay, and there you go on that video and that report. And thank you for joining us for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.